So this video shows two very important things. The first thing, so set this up. This is my records from my first CT scan from April 22nd, 2019. St. Vincent East Hospital, Birmingham, Alabama, Ascension Health. I had a head, skull CT scan, and I had a cervical neck scan. So two different scans. Alright, now the first thing this video shows, these are my records that I obtained from the hospital on 5/20. 2019. Okay, the first thing is the hospital does indeed apparently keep dual or multiple sets, tiers, layers of records on various medical cases, encounters, patients that come through, etc. So in the records I got from St. Vincent East myself, there is a lower level of detail apparently, because when I got my records from Christ Health Center, this is from the Woodlawn and Springville Road, Chalkville visit. I got these on May 22nd. So I got the ones from the hospital May 20, these on May 22nd. Now in the Christ Health records, they apparently had requested from St. Vincent's East, the account regarding the CT scan of my head and neck. And what you can see in their records, this is Christ Health's, they include some Xeroxed documents from St. Vincent's East Hospital. And, I had my other records, I got these. What shows up in the Christ Health records, this don't show up in my records. So I'm going to put this out here. And what this tells you, the main thing is they've got dual or multiple sets of records in different detail levels for various parties and instances. They give me, the patient, one level records. These doctors, nurses at Christ Health Center, they make a request, they get another level of documentation about my own experience there at St. Vincent's East Hospital regarding this CT head scan. Okay, and just my observations on these things, these deal with like time codings. So it'll say, for example, okay, it reads like this. Result type, CT head or brain scan without contrast. Result day, April 22nd, 2019, 8:48 a.m. or 8:48 CDT. Result status modified. CT head or brain without contrast. Performed by Jurhan MD Julian P. on April 22nd, 2019, 8:59 CDT. Verified. Same, and it shows encounter info. So this stuff is not in my records. And another thing that was included along with these were two images. And I assume these are images from the actual CT scan. I'm not sure what image they chose to send because it's not included here. So this is very interesting. Very, very interesting stuff. All right, and so one thing you notice with these Christ Health documents is there's a line, and I just read it. It says result status modified, and this is regarding the CT head or brain without contrast. You look at this, the details on this, it reads, no intracranial hemorrhage or mass effect, ventricles, basilar cisterns maintained, gray-white differentiation is preserved, no CT evidence of recent territorial infarct, rounded area mucosal thickening in the floor of the left maxillary sinus, orbits are unremarkable, no asymmetric scalp swelling, hematoma identified, no acute calvalarial defect is seen. Impression, no acute intracranial abnormality identified. This is an electronically verified report, Julian Patrick, Durham, MD, 8:55 a.m., 4/22/2019. And again, the Christ Health documents show different time codings and record keeping data, and what you can see in this is that this account here by Dr. Julian Patrick, Durham, MD, radiologist, it has been modified. Okay, so next thing is you go to my records. They don't include this information that this result, this reading analysis, this has been modified. And to follow this up, so look at the images, okay? The head images from the CT, they're pretty clear what's going on here. This shows head trauma. It shows a broken up, fractured, broken up bone on the underside of my skull, occipital condyle, condylar canal, possibly foramen magnum is also damaged. This is what shows up if you actually look at the images, okay? And this probably has something to do with why this was modified. I'm not going to speculate very much, but I think they got these images. They could, it's pretty obvious what you're looking at. This is a serious injury, and it went in maybe one way, and then by the time it wound up finalized, it wound up like this. So what's going on in this place? Because this is a life-threatening injury, and basically because of this erroneous diagnosis that these people gave me. I've been condemned for the last 2 years. I go around to different doctors. They pull up these documents, and it says there's nothing, there's no acute abnormality. So, then they start to question my psychological state. However, you print out the pictures, you pull them up from a CD. You look at them yourself, you can clearly see what the problem is. But see, that doesn't matter, at least to the doctors that I've gone to. You look at one of the scanning series of the head CT, it clearly shows they cropped my head in such a way to where you can't see the injury so well. It does show up in the bottom corner, but why did they crop this picture? I don't understand this at all. So in summary, this shows that there are at least two sets of records that are available to go out to your different parties from this hospital, depending on who you are requesting them. Next thing is this clearly shows that this analysis regarding the head CT, it says right here, this was modified. All right, so why'd they modify it? Because their verdict, their analysis, this is not correct. It says there's no acute abnormality. No, that's not true. So what they ended up putting out, this is not correct. Shows it was modified. Why was it modified?